Hello, everyone, and welcome to my show. Autumn is here. I'm your host, Francine Crawford. Today, we're speaking to Patricia Morris. She is a retired head nurse, and she has worked in long-term care for 44 years. Welcome to the show, Patricia.
Thank you. It's a pleasure to be here.
Thank you for taking the time to speak to us. I'd like you to tell me just a little bit about yourself, about your career.
Okay. I actually went to a high school for health professions, and I became a licensed practical nurse after graduation. After working in the field of nursing for approximately 10 years, I realized that I wanted to go further. So I went after I had went into college for nursing, but switched my major to psychology. And then I was doing my graduate work in rehabilitation counseling. And then I realized that that was not what I wanted to do. And I went back to college and became a registered nurse. All this time I was working in long-term care, and I continued to work in long-term care, even though I did stints in the hospital and in acute care. But that was part-time, but my full-time work has always been in long-term care.
Okay. So long-term care, what exactly is long-term care?
Okay, there's usually three levels of care. There is acute care. That's when you're in the hospital and you're doing and you're being treated for some acute condition. There's intermediate care where you're still in the hospital, but your condition is not acute, but you're not quite ready to go home. But long-term care is people who are expected to be in care for at least 30 days or longer. Long-term care can be short-term rehab, where you're recovering from an injury. A lot of times, if you spend any time in the hospital, you lose your ability to function. And in long-term care, so you will be in short-term rehab. Mm-hmm. But then a lot of times, once people complete short-term rehab, they're no longer able to function on their own at home. Even though they have met their highest level of function, that function does not allow them to to be in their home setting without extensive care. And oftentimes families cannot provide that care. So they have, you stay in for long term.
Okay. So my understanding is that you work with patients with dementia or Alzheimer's for periods.
I did. I was certified in dementia or Alzheimer's care, and I worked on an Alzheimer's unit with 40 patients. That was my passion. I really like working with them. And I did that for maybe 7 or 8 years. Then I worked exclusively with Alzheimer's patients.
Okay. So I'm sure working with seniors and with the disabilities and things like that, it's always challenging, but especially with people with dementia and Alzheimer's. What would be some of the challenges that you face with dealing with people specifically for dementia and Alzheimer's?
Okay. Most people think that, if I forget something, if I forgot where I put my keys, or if I can't find my phone or something that it says, I'm getting Alzheimer's. But Alzheimer's is much more debilitating than that, because you may forget that where you put your keys, but when you find your keys, you know what your keys are for. And sometimes with patients with Alzheimer's, they don't remember what a key is. Or if they have a pen, they don't know what a pen is used for. They don't know that when you place a fork in their hand, that they're supposed to use that fork to eat. And sometimes in the late term Alzheimer's, they even forget how to eat, how to chew. And that's when they wind up with tube feeding. A lot of people, they says, oh no, you got to put the tube in. But if that's their only means of getting nutrition, then you do what you have to do.
It's a hard decision to do that, to make that decision also.
Yes, a lot of families had a very difficult time with that decision. But unfortunately, it is a decision that a lot of families have to make. Even the decision of allowing your loved one to be in long-term care is very difficult, because it's like you're giving up on the patient, or you have unreal expectations of what the patient can do or what they cannot do. I had one family who was the daughter was very upset because the mother kept calling her by the other daughter's name. And she'd say, oh, she knows who I am. She's just doing that to be mean. I don't know why, but we could not impress upon her that this was not something that was being done deliberate, but that was just one of the symptoms of Alzheimer's. A lot of times the patients will call their child by their sister or brother's name.
Okay.
Or because they don't realize, that part of their brain is gone.
Wow. But as a nurse dealing with that, you deal with the patient and you also have to deal with their family.
Yes.
So how is that? How is that, being able to deal with an Alzheimer's patient with them not remembering, or sometimes I'm sure they get agitated or frustrated. Are there certain tools that you use or certain things that you've learned to be able to deal with them?
Okay, one of the things that we try to do with our Alzheimer's patient is to keep their environment as consistent as possible. We try to keep the same caregiver for them instead of having a different, aide take care of them every day. We try to be consistent in allowing the same aide to take care of that patient on the 5 days that they were at work. We try to keep the routine. They get up in the morning, they do their, they have their ADLs taken care of, they have their meals, they go and they interact with other patients, and you just try to keep a simple routine and a consistent routine so that their basically there's no big changes, because sometimes big changes can cause a decline in their cognitive function.
Okay. So when you in the environment, do you see that there are people, I guess if they're there for a long period of time, Alzheimer's seems like it's a slow moving disease.
Yes, Alzheimer's is. You can have Alzheimer's and you stay at one level of functioning for years. And then some people have a slow decline, but some people will plateau at a certain level. And then once they something happens, there is an illness or a fall or something, and all of a sudden their cognitive function drops significantly. And you don't know when it's occurring, but you just know that it has occurred. You don't know. It's very difficult to figure out why. The whys of it is just that, you try to follow it and try to minimize you try to minimize the causes that you can minimize, the environmental part.
Okay. And dealing with the families, do you suggest something for the families? Is there programs for the family or something like that? Because they have to get, just like you're taught to deal with them, Do they get any kind of information, pamphlets, something that will help them to deal with them and to explain exactly what's going on?
At the facility that I worked at, the most recent facility that I worked at, we provided the patient's family with information. We had monthly or quarterly meetings with the families to try to provide them with information about Alzheimer's and how to deal with it. Some families took the information and they were very helpful. Some families were in denial. And they didn't want to hear it. It's very difficult to see your family member change before your eyes. Some patients who were calm, mild-mannered, church-going, Bible carrying, became, they lost their sense of inhibition and they'd walk down the hallway naked. They curse like a sailor. And this is it's very difficult for family members to see their family member change. So you have to try to be gentle and firm because you don't want them to, I won't say lash out, but be harsh with the family members. Like the one I told you, who her mother called her by the wrong name. And she would get very upset about that. And she'd lash out at her mom. But, there wasn't much that we could do about the mother's behavior, but you tried to help the daughter to deal with it. There were also, we would recommend that they seek out support groups, or there was a very good book. I think it was called the 36-Hour Day.
Yes.
And that was a very good book, and we would often recommend that one to the family members.
Okay. And as a nurse, being in that unit for a long period of time, I'm seeing people come in at some level, and then they lose some of their thought processes and things and their functions. And as you see them in there for a long time deteriorate, how does that affect you? Like, help me to understand a little bit about being a nurse in such a unit like that, how difficult that is.
It was difficult, but in the same thing, in the same way, it was rewarding because you would see patients. I had one particular patient, she would sing all day. If you see her, she was singing and she was smiling and she was always happy. Before we realized how she was losing, that she was deteriorating when she couldn't remember the words to the songs anymore. And she used to walk all day and walk and sing and smile when she couldn't walk anymore. And she had become confined to a wheelchair. So, but even in that, there was a glimmer of hope because she would, if you start singing with her, she would try to sing the songs. We had patient who, one I particularly remember, she used to curse. If you came near her, she would curse and curse and curse and call you all kind of bumbleplod and all of this stuff. But if you sat down and talked with her for a while, she would calm down and she would carry on a decent conversation with you. So even in all of the loss of memory and all of the thing, there was still in your day, you was going to find at least one patient who was going to make you smile.
Okay. So what is, you're being in that field and dealing with Alzheimer's patients, what is your I'm just asking you if you have any insight or any hope for this particular situation and disease and the care of patients like this? We know that there's no cure, but is there anything that you want to say that is encouraging?
Well, I know they have medications that are supposed to help. I don't know if they are. actually helping or slowing down the progression of it, but I'm hopeful that they will find, if not a cure, at least a cause. Because if you can figure out a cause, you can figure out a treatment, and a treatment would be such it would be very good for someone who is dealing with it. I mean, I know that most people think that Alzheimer is an old people disease, but it actually affects younger people. The youngest patient I dealt with, I think, was in his early 40s. He had been a math teacher, and at the time that I met him, he could not even feed himself. And this was in his early 40s. He had teenage children. So his wife was dealing with him and his issues and trying to raise teenagers. So I think I'm hopeful that if nothing else, if they could find a cause and then work on a cure or a treatment.
Okay. So it's one thing. If you would, what would you say to caregivers or people in the family who are dealing with someone who they may not be in a long-term facility at this point, but they have dementia or been diagnosed with it, or they see some signs of it? What would you say to them? What advice would you give them?
Get help, because dealing with dementia is very difficult, and it's wearing on you and on your well-being. Mm-hmm. It is very difficult to try to deal. I know someone who had their mom, and the mom would wander out of the house in the middle of the night while they're sleeping. Mm-hmm. She would get up and go out. If they went to work, they had to lock her in the house to keep her from wandering, which was extremely dangerous. Mm. And I prayed every time they told me that they had to lock her in the house to keep her from wandering. I'm saying they took all of the knobs off the stove to prevent her from cooking. So my thing is to get help. If it's not long-term care, then daycare or someone where someone can help you. Because trying to go it on your own is very difficult, is very draining, and it can cause you can, a sick caregiver cannot take care of anyone. So you have to make sure you take care of yourself. I think when you're on the airline, they tell you that if they lose cabin pressure, to put your mask on before you try to help somebody else. So you have to get help for yourself to make sure that you're able to help someone else.
Okay. That's great advice. Is there anything else that you would like to say? Maybe we missed or something?
Well, while there's no cure, there's always hope. And we have to continue to be hopeful. We have to make sure that if you are someone or know someone who has dealing with a parent or a relative with, offer assistance, as even if it's a minute. You say, I'll sit with them for the afternoon while you go and get your hair done or get your nails done or run to the grocery store. Just offer assistance to someone. And that would be my thing, is that don't just watch someone suffer. To offer assistance as needed. Okay.
Thank you so much. Thank you so much for your time. Thank you so much for giving us this information. And thank you for, working in, a long-term facility like that with Alzheimer's. I know it's difficult, but like you said, there is hope, and it was rewarding to you.
Yes, it was.
Yeah. So I thank you so much for sharing that story and sharing this information and I'm sure it will help somebody who is either caregiving or, may possibly be a caregiver at some point. Something for people to think about now so they can prepare a little bit better. So, Okay. So thank you for being on Autumn is Here.
Okay. Thank you.
All right. Good night.
Good night.